EBMT has prepared a couple of special sessions on COVID-19 and infection by the SARS-CoV-2 coronavirus. It's difficult to escape the topic given the broad repercussions of the pandemics and practices in medicine in general, hematology, oncology, cellular therapy, stem cell transplantation in particular. So my talk will be the last one of the session, and will focus on the use of monoclonal antibodies. And actually I extended a bit beyond monoclonal antibodies, strictly speaking, to add a few words in general on treatments that aim at modulating the immune response. A general feature of the COVID-19 pandemics is that we have been learning at an unprecedented pace, never seen this before. Scientists all over the world have generated a huge amount of preclinical and clinical data. One of the problems actually is to discriminate between high quality and somewhat lower quality information that is being circulated. Anyway, an important component in the COVID-19 infection is the hyperimmune response that can do some damage to the patient. And in many aspects, it's quite similar to side effects and complications that we are witnessing when using some of the treatments we are very much used to. And in particular, the hyperimmune response in COVID-19 mimics several aspects of the cytokine release syndrome that is commonly seen after CAR T cells, for example, or in some instances after haploidentical transplant. So I will talk about some of the published data that use tocilizumab or other IL-6 receptor blockers that showed some efficacy in patients with the most severe forms of the COVID-19 disease. There are other agents that target cytokines, for example, the IL-1 receptor axis that have also been evaluated, although the experience is less extensive. There are some projects in development to design monoclonal antibodies that would directly target the interaction between the virus and the cells that are being infected, in particular in the respiratory tract. So I would say that we do have at hand some therapeutic agents that can mitigate the most severe forms of the COVID-19 disease. Not all patients are candidates to receive such treatments. It's not necessary in the mildest form of the disease, but it can help a fraction of the patients with the most severe forms of COVID-19.